thing that we should be cognizant of for prevention of thyroid disorder? And I'm guessing those are the same. Reversing and prevention are kind of in the same question.
Yeah, absolutely. So I guess the first thing I should have mentioned too, as far as the cause of hypothyroidism and hyperthyroidism, you have to find out the cause, right? So worldwide, by far the most common cause of hypothyroidism or even hyperthyroidism is iodine deficiency, right? So I should say hypothyroidism, because if you have excess or too much iodine, it would cause great hyper. But worldwide, the most common cause of low functioning, under functioning thyroid is iodine deficiency. So, simply said, if you're undernourished for any reason, then check your iodine levels. And that's something that's simple and easy to fix, right? You just start taking iodine. And we could talk about methods of iodine supplementation in our diet also later on. But the other thing is to know that when you're in America, we don't suffer from iodine deficiency like the rest of the world does, or many places in the world does. We suffer from nutrition excess, if anything, right? We got too much food. So in America, by and far the most common cause of hypo and hyperthyroidism is not iodine deficiency, although that does exist in certain populations, but it is actually the autoimmune system, right? The attack.
Lewis, is that Hashimoto's as a peculiar type of thyroid dysfunction?
Yeah. So Hashimoto's, named after Dr. Hashimoto, would be hypothyroidism caused by the autoimmune disorder, an immune system creating antibodies, right, that are attacking the thyroid gland. And the same goes with Graves' disease. Then it's only that the antibodies are attacking the mechanism for controlling the thyroid gland, and now the thyroid gland is out of control, right? The train conductor is off the rails, doing its own thing. So the immune system, unfortunately, has the ability, like we may know, a lot of conditions go haywire when your body is attacking itself, right? When these little proteins that seem so unassuming, called antibodies, are basically are behaving like self-guided missiles towards specific target areas of our body and causing destruction.
And before you even go on, I remember I had a question about the blood tests to check your TSH, even to check your iodine. Is that something to get the TSH checked, the thyroid stimulating hormone? Do you have to be visiting an endocrinologist? Can you help people with that? Can we order our own blood tests? What's the process of that?
Yeah, I always encourage having a primary care, having a general practitioner who's helping you, even if you are on a more holistic lifestyle, right? You may, even if it's just a functional medicine practitioner, and I shouldn't say just, because functional medicine providers are great also, but I always recommend someone who can not only order the tests but also interpret them for you. So that's my recommendation. Myself, of course, if I have patients, I'm the one doing that. My clients, people who go through our coaching program, I encourage them to stay in touch with their provider and ordering that. Now, I should say this too. This is important too, because, and of course, on this channel, we have a lot of Seventh-day Adventist Christians, people who have adopted, for spiritual reasons, plant-based or vegan diet. And also for health reasons, they may exclude iodized salt, right? So 1920s actually fixed the iodine problem in America. So that's the reason why many people in the world, other countries, don't have have iodine deficiency, is because they don't have the supply of iodized salt that we have in this country. But there are many health conscious people who exclude salt from their diet for a good reason, right? But it's kind of a double-edged sword now. Now you can run into the risk of iodine deficiency, especially if you're vegan, because, and might come as a surprise to you, Scott, but when you're a vegan, you're excluding another source of iodine in the general population, that's milk. And it's not that the iodine is naturally in the milk. Iodine is actually present in all or many food sources in small amounts, but how milk gets iodine to the public is through the disinfectant. Iodine is disinfected on the teats of the cow, right? The udders of the cow. So that actually leaches into the milk.